Imagine feeling like your smile is completely beyond repair. You're dealing with discomfort, you have trouble eating, and every time you speak or take a photo, you actively try to hide your teeth.
For many of our patients at Smile Dental Turkey, that isn't an exaggeration at all. It's their daily reality. But today, we're going to talk about exactly how we turn that around.
Welcome back to the podcast. Today, we are taking you behind the scenes of a complete full mouth restoration. We're going to walk through a real case study of a patient named Jason.
That's right. We're breaking down the exact clinical steps we took, the timeline, and because we believe in 100% transparency, we are going to share the exact cost of his treatment.
So, if you or someone you know is struggling with widespread failing teeth and considering dental implants, this episode is going to show you exactly how the process works. Let's start at the beginning. Jason came to our clinic in February 2025. What were we looking at when he first sat in the chair?
When our lead surgeon, Dr. Özkan Özkaynak, first examined him and took a full panoramic X-ray, the situation was quite complex. Jason had multiple decayed and broken down teeth. Several teeth were already missing, making it incredibly difficult for him to eat and speak normally. Plus, some of his older dental work was beginning to fail.
And when you have widespread issues like that, fixing one tooth at a time just doesn't work, right?
Exactly. Piecemeal dentistry won't cut it. You need a comprehensive reset. So Dr. Özkaynak developed a phased 8-month treatment plan designed to give Jason a permanent, fixed solution.
The process was broken down into 3 specific visits to our clinic in Antalya. Let's talk about Visit 1, creating the foundation.
In February 2025, our first priority was getting Jason out of discomfort and clearing away the decay. We had to extract 13 teeth in total, 8 in the upper jaw and 5 in the lower jaw.
Now, a huge fear for patients is leaving the clinic without teeth.
Yes, and that simply doesn't happen. Immediately after those extractions, we fitted Jason with a set of custom-made temporary dentures. This ensured he could still eat, smile, and go about his life confidently while his gums and bone healed.
That brings us to Visit 2, the implant surgery. After 3 months of healing, Jason returned in May.
Right, his jawbone was healthy and ready. For his upper jaw, we used an All-on-6 approach. We strategically placed 6 Neodent implants, which are manufactured by the world-renowned Straumann Group, into the upper jawbone. Those 6 implants are incredibly strong, enough to support a full arch of teeth.
But his lower jaw was a bit different, wasn't it?
It was. He still had some healthy, natural teeth remaining. Rather than extracting perfectly good teeth, we placed 4 implants in the lower jaw. Those 4 implants, combined with his natural teeth, would support his lower bridge.
Visit 3, the final smile. Fast forward to October 2025.
By October, the implants had undergone a process called osseointegration. That's the medical term for the jawbone naturally fusing to the titanium implants, locking them permanently into place.
Once they were locked in, our dental lab custom-milled 25 metal porcelain units. For the upper jaw, we secured a 13-unit bridge to those 6 implants. For the lower jaw, a 12-unit bridge was attached to the 4 new implants and his natural teeth.
We also did 2 minor fillings and provided a custom night guard to protect his new investment while he sleeps. The final result was a completely non-removable, fully fixed smile that functions and feels just like natural teeth.
No more hiding his smile. Now, let's talk about the investment because we know this is a major factor for anyone listening.
For the entire 8-month process, across 3 visits, which includes 13 extractions, temporary dentures, 10 premium Neodent implants with abutments, and 25 custom metal porcelain crowns, Jason's total investment was £8,933.
Keep in mind, every patient's anatomy is unique. Your exact treatment plan might require bone grafts or a different number of implants, but Jason's case is a perfect benchmark for what a complete transformation looks like. Now, before we wrap up, we need to address the elephant in the room. Hearing about having 13 teeth extracted and 10 implants placed sounds intense.
Very intense. If you're feeling anxious just listening to that, you are completely normal. Almost every patient we see has the exact same fears. Let's tackle the top 3 questions we get about this procedure. Number 1, is it going to be incredibly painful?
This is the biggest fear by far. The reality is the surgery itself is completely painless. We use strong local anaesthesia, and depending on your anxiety levels, we can discuss sedation options. You won't feel sharp pain, just some pressure.
Afterwards, yes, you will experience some swelling and soreness for a few days, similar to having a tooth pulled, but the vast majority of our patients tell us that over-the-counter pain relievers, combined with the medication we prescribe, make the recovery completely manageable.
Question number 2. Will I have to walk around without teeth while I heal?
Absolutely not. We mentioned this with Jason, but it bears repeating. We will never send you back to your hotel or put you on a plane with missing teeth. You leave the clinic on the very first visit with temporary teeth designed to look natural and protect your gums.
And finally, question 3. Will I really be able to eat normally again, or am I stuck on a soft food diet forever?
During the healing phase, those few months between your visits, yes, you do need to stick to softer foods so you don't disturb the implants. No biting into hard apples or chewing ice. But once those final porcelain crowns are permanently attached, your bite force will be nearly identical to healthy, natural teeth. Steak, corn on the cob, crusty bread, it's all back on the menu. The goal here isn't just to make you look good, it's to give you your life back.
If you have other fears or questions holding you back, we want to hear them. You don't have to guess if you're a candidate.
Reach out to us at Smile Dental Turkey for a free, no-obligation consultation and a digital smile assessment. We can look at your x-rays and tell you exactly what's possible.
Thanks for listening, and we'll see you on the next episode.